And okay, today we are going to do in our lecture Sudan Quarantine Law 1974, which mainly focusing how we can control the epidemic disease, how we can control the epidemic disease. Mainly, as I mentioned, this law, they're focusing how we can control infectious disease through the quarantine, which this law is aligned with the International Health Regulation 2005. As I mentioned, the International Health Regulation 2005, all countries that take this regulation and develop their own law. This is one of example like Sudan, India, United States, German, many countries that develop quarantine law based on the international health regulation. In this lecture, we are going to see the Sudan Quarantine Law 1974. The purpose of this law mainly, the objective is going to focus to prevent entry and spread of the disease here. How can prevent the infectious disease that come from the out of the countries, and also how you can restrict it if we have the infectious disease, how you can control it and not let to spread to the another countries here. This is the one of the purpose. Another purpose to regulate measurement of the port and airport and land border. How you can develop it, or how you can have the good regulation to control the movement of the goods and movement of the traveler and movement of the aircraft between the countries here. This is even in Sudan exactly based on this law. Yeah. Last purpose of this law to ensure the public safety during the outbreak. If there are outbreak in Sudan or outbreak out Sudan, how you can control this outbreak with the quarantine law that definitely can help us and control that outbreak with the regulation that organize the movement of the people and quarantine the suspicion and also isolation as the cases of the infectious disease here. By this can let us to save the public during the outbreak. This is the purpose of this law. Now let us to see to next slide the scope of the Sudan Quarantine Law 1974. The main scope of this law is going to apply to the ships movement and aircraft movement and train and also road vehicles, and also for the travel passenger. They are moving from state to state or move from country to country. This law is mainly going to apply for this, as I mentioned. Ships, how the ship they are moving the goods or the thing between the countries here. How this ship to be safe to avoid our countries from the infectious disease. And aircraft, as you know, this day there is the movement of the people is very high. That's why this law is also important to restrict the infectious disease. Additionally, as I mentioned, train also how can organize the movement of the trains and on vehicles, and additionally for those people whom are moving, as I call it, traveler. The major coverage of this quarantine law, we are going to use the isolation measurement and disinfection measurement. Additionally, vaccination of the travel. Lastly, the surveillance also is going to use in the yes this also the measurement of this health quarantine law Sudan 1974 isolation of those have a disease and disinfection the train or the aircraft. Request from the traveler to have vaccination card or vaccination certificate. Additionally, the measurement of the surveillance. This is scoped by this law, Guarantee Law Sudan 1974. Now let us to go to next. The key provision, the Sudan Quarantine Law 1974, they have 4 sections. All provision they are included in the 4th section. Section 1 is the general provision. This is included from Article 4 to Article 22, and the special provision from the Article 23 to 66, and miscellaneous is included from the 67 to 73, and panel of this law is art of the Article 187. All of this is all article of this country. This law is a very big, but I summarize it here. Main section, and also in any section I selected what is the more important point or what is the more important article which related with the international health here. Yes, this is a core section. Anyone, if you need to go deeply through this, you can go and read more about this here. But unfortunately, what I realized, the Sudan Quarantine Law 1974 now is available by Arabic. Those people have more interested, let them to translate. I need volunteer from you to translate this law. Let us go more. Let us see the section 1, which mainly focus in the general provision. The key point which you focus on it, health direction by authorities. This you can find in this article 4 to 22, mainly focusing in the health directive by authorities. This is the one. Additionally, they have the mandatory of the outbreak reporting. All countries, they must report if they have outbreak in their countries. Yeah. Moreover, have the border inspection. The ship and also the aircraft and also the traveler must do inspection in the entering point. If you need to leave and also if you need to come, you must have the inspection for the all cargos and also for the traveler and even for the aircraft. All of them, the inspection at the entry gate, yeah, or point of entry. Last point for the general provision is the movement restriction for suspected cases here. If some people come from the outbreak countries or outbreak areas, they must spend the incubation period of that disease here. The movement must be restricted, not give them the freely movement. Thirdly, they must spend the period time of that disease. After that, when they not have symptoms of the disease, they can go and move freely. Yeah. This is in the section of the general provision is mainly focusing in the health directive by authorities. Secondly, mandatory for outbreak reporting. Third, border inspection. Fourth is the movement restriction for suspected cases. Now let us to see the section 2, which is focusing in the special provision. In the special provision, they are mainly focusing in the incubation period of the disease here. Like example, Article 23 to Article 29, they're mainly focusing about the plague. As I mentioned, the plague, one of the very dangerous disease, have ability of has a high fertility rate. That's why included here. The incubation period is 6 days. If there some sheep come from the Italy or come from another country, those or come from the suspected area, they must spend like the traveler and also the sheep, they can spend like 6 days to wait and see those traveler. Is it developing the signs and symptoms or no? Yeah, the call it incubation period of the plague is the 6th day. Additionally, in the special provision is the cholera, which mainly focus in this law from Article 13 to 37. It's mainly focusing in the cholera. Incubation period is the 5 days. Water and food disinfection, how we can, if there's some sheep or some traveler come from the outbreak area, they must spend like 5 days here to make sure. Even how can do the disinfection of the food and also for those teams and also even for that cargo or ship, how you can do disinfection from the to do disinfection. Let us to see also this is the special. We still continue in the special provision section. This is the also we are going to in the special provision also includes the yellow fever. Yellow fever is from Article 38 to 44. An incubation period 6 days. In this, also focusing how those participants or how that is it have the card or not have the card. Yeah. Example, those passengers, is it have the vaccination card of yellow fever or not have? Because it's a required. This is mainly focusing Article 38 to 44. This mainly focus on the yellow fever. Additionally, smallpox is included from the Article 61 to 66. Incubation period for the smallpox is 14 days. And how can we say if there are some suspected cases or if or confirmed case, how we can deal with that issue? Yeah, all of this you can find in the article 61 to 66 here. This is included here. Now let us to see the section 3, which is miscellaneous provision. In this section, mainly focusing for requirement, they started from the article 67 to 73. How can do the health declaration for the aircraft or ship if there are some suspected cases or confirmed cases? How can do the declaration? Additionally, international vaccination certificate also is required from the passengers and also for the ship and also for the visitors, yeah, must have the certificate. They are free from the suspected disease. Yeah. Additionally, focus in the fees of the inspection. Those traveler or that ship, they must prepare the fees for the inspection, yeah, because there is a team when they are coming in the port. There is a team of inspection, yeah. They must pay for the inspection. This is the section 3, miscellaneous provision. Now let us see the disease coverage by this 19 Sudan Quarantine Law 1974. I'm mainly focusing for disease here. Focus in the plague and cholera and yellow fever and smallpox. This is the summary for all this disease. The plague, as mentioned here, 6 days incubation period, and the main measurement that we are going to take during the movement of the ship or the ship, they can do the rodent control. Perhaps inside that ship, perhaps they are bringing some rodent from the outbreak area. How you can do the isolation if they are suspected or confirmed case from the infectious disease here. Additionally, in the cholera, as we mentioned, the 5 days incubation period. The measurement, how you can do the water sanitation and also food sanitation. How you can do the disinfection of the water, and how you can make measurement of the food movement or food handling and traveling to get good measurement to save or to protect our population. In yellow fever, incubation period is the 6th day. The mainly measurement they are going to focus, they are vaccinated. Is it passenger have the vaccination card or not have the vaccination card? Additionally, can make the check inside the ship or train or plane. Is there some vectors like mosquito like that, yeah? And then they can do spray or can control it, yeah? Because sometimes during the traveling of the passenger, they can carry or they can hold some vectors that can contribute to outbreak. Last disease is a smallpox, and incubation period is 14 days, and they have the restricted isolation. If there some the passenger can put it in the quarantine in 14 days, like 14 days. If there some is from some passengers develop with some signs or a symptom of the smallpox, they can put it in the isolation. Yeah, and they have very restricted isolation measurement for the smallpox. Now let us to see the quarantine procedure, the process or the procedure of the quarantine at the port before enter the countries. Yeah, like in border in Guinea Adre, or also in the port of Sudan, and also in coast there. At the border there is some procedures. There are some procedure. One of the procedure they are going to take as the entry point, the inspection. If the passengers, if the ship or train, anything, they must do the inspection. Another also can do the isolation. If those people put it in quarantine, they confirm it have some infectious disease, can put it in isolation, then can treat them. Additionally, can do the disinfection for that movement, like train or also like cars or vehicles, or can do the disinfection. Yeah, disinfection from the rodent or disinfection from the anything here to avoid the spread of the disease. A concern for the travel for the people, they must prove they have the vaccination card, like yellow fever, like COVID-19, like that. At the entry gate, must ask like this. Additionally, symptom of the surveillance, yeah, can ask them, do you have some, and collect some data about where you are come and when you are going, how many days you are going to stay, the detail for the surveillance. As you know, the step of the surveillance, they are going to do it. Yeah. This is the procedure in the quarantine. As I mentioned, at the bordering, they are going to do the inspection and isolation and disinfection. Concern for the traveler, they are asking them about the vaccination card or certificate, and also symptom for the surveillance. Yeah, this is the procedure. Now let us see the roles and responsibilities, like Ministry of Health. What is the policy of the quarantine? Port health officer at the entry gate, like for Sudan or in Adre or in in Malha or in Kostizev, they are the health officer. They are responsible for the quarantine. Those teams, they are responsible to do the inspection and guide the people how you can dealing with the suspected and how you can dealing with the cases. Yeah, WHO, the technical support. If there are some outbreak there, how you can support them. Sometimes supported by supplies, by many things. Yeah. Yeah, concern for the Minister of Health, as I mentioned, develop the policy. Port health officer there do the inspection and enforcement. Additionally, WHO, they can support technical support, provide technical support. Now let us see the penalty for non-compliance. If some cars or some traveler or some ship, train like that, well, there is mentioned here, there is a fine. Yeah, fine for those non-compliance for this law. Additionally, in prison, can put it you can arrest you in the imprisonment. Additionally, destination for non-compliance for the vessel and aircraft. All of this is the penalty for non-compliance. Fine and also imprisonment, or both of them. This is the last slide. We are going to see the importance for the Sudan Quarantine Law 1974. Importance and recommendation. Why this quarantine law is important? One of them, to prevent the epidemic via border control. If there are some epidemic come from our neighbor countries, this law is going to prevent us. If you follow the good procedure, can prevent us. Additionally, is allied with the global health standard, international health regulation, because it's being updated and be more allied with the international health regulation. As you see, this law is a 1974, but now it's updated. There's some amendment in the some regulation inside the law. The recommendation for this law, modernize the facilities. It's very important to use more updated facilities in the point of entry. Additionally, public awareness campaign. It's very important to let even the community or people know about this law and how this is important, because to protect themselves. If there are some passenger come without inspection or so, it's very important to notify. Additionally, strings international cooperation. This law needs the international cooperation between the countries and also from the WHO. As I mentioned there, provide the technical support. Thank you for you. If the question raise your hand. If you need to edit comment, you are welcome. Thank you.
Okay.
Hello?
Hello?
Hello, Mudassir, you are welcome.
Okay, what I want to say is that this quarantine law is since 1974, and there are updated pictures that appeared throughout this long time. That it's almost about more than 50 years. Don't you think that we need to update our law to include like Ebola, COVID-19 in our quarantine law, or it can be updated automatically through health authorities when we are working? And how can I apply without that law? And for example, if we have like COVID-19 and Ebola and other infectious diseases, which are very serious and severe in the community, how can I apply this law to the to perform my job actually? This is the point.
Okay, thank you, Mudassir, for your question. You are mentioned there some disease they are more updated, like COVID-19 and also like Ebola. Yeah, as I mentioned, this law is put it in 1974. And as I mentioned, this law is mainly going to covering like 4 diseases, as I mentioned, like yellow fever and also like cholera and plague, like that, yeah, as I mean, and smallpox here. This law has been amendment. There do some amendment in the SAMSA regulation, yeah. As I mentioned, this law has many articles, but has been amendment, yeah, to include to be more aligned with the international health regulation, which developed in 2005 by WHO. Yeah, this law has been has been updated, yeah, or upgraded, yeah, to be more familiar with the international security pandemic and also international security health issue. That's why by this we can control it. Yeah.
Thank
Is
you.
there any question or comment? Additionally, concern right now we are studies the some laws in the quarantine and international health regulation. Yeah, this law is very big, but I do my job. I do the summarize. As I mentioned, this law have more than 100 articles. Yeah, but I do the summarize. Yeah, I put it like in 4 main provision. Like public provision, special provision, after that miscellaneous, after that panels here. Then in each part, I selected the article that more related with the international health regulation. In spite of all this, the more related, but is the more clear for us and can support us to use it in the future. Additionally, if anyone from you need to go deeply, just you can go through this regulation, yeah, with this internet health regulation, internet health law 1974. Right now, there is in Arabic. If you go in the site or in the Google and put it, you can find, yeah. But in the Arabic version, anyone, if you need to go through it, it is good. I hope if there some of you volunteer to do the translate for that law to be good for us and even for good for your colleagues, yeah, and for the public health, yeah, that can help us, yeah. But that law has been more updated, yeah. Yeah. Thank you. If no question and comment, now let us to say thank you for you and really appreciate for your attendance. My advice just you have to read on daily basis or yeah on daily basis is very important to do revise and read. Yeah. As you know, you have many lectures and also many courses. Yeah. And you know the exam is going to take place as soon as possible. Yeah, that very important for you to be ready for the exams. Yeah, thank you for you and have a good moment or good night. Yeah, take care.